Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello, everyone, and thank you for listening to the Medical Sales Podcast. I have a very interesting guest that I'm proud to bring to the table for us to listen to today. His name is AJ Rollsy. He's the founder of HealthPoint Research. They're a research marketing firm that specializes in healthcare. And he talks about this report that they're creating that allows companies to see how effective their sales reps are in influencing behavior with prescribers from the prescriber's perspective. And it's really fascinating stuff because it's something that can be valuable to the sales rep to use in the field to improve their skills and be more effective, and something that can be valuable to the companies to understand how they're being perceived by the physicians they're working to influence. We go into a lot of different information. A lot of known researchers are involved in what he's working on. To name one of them, Robert Cialdini, he wrote the book Influence. One of the nice highlights that I want to just mention now is he talks about the 7 factors of influence and how this paper that they're working on, this report that they're working on, it's actually based on 10,000 different data points that are screened through, if you will, the 7 factors of influence. And once again, how effective these sales reps are from these different companies in influencing their prescribers from the prescriber's perspective. So you can only imagine how valuable that is if you're someone in the field, or of course, if you're a company that's responsible for sales reps. So you're going to love the information he shares with us today. It's really fascinating stuff. Thank you again for listening to the Medical Sales Podcast, and I hope you enjoy the interview. Hey, Jay, how are we doing today?
I'm doing good, Samuel. How are you, man?
Good. No complaints. Just making sense of everything and figuring out how to do it in these quarantine times.
Right.
Today, everyone, we have AJ Rollsy. He's the founder of HealthPoint Research. Now, they are a marketing research company that specializes in healthcare. So, AJ, why don't you go ahead and introduce yourself to everyone?
Yeah, thanks, Samuel. So, first of all, to your listeners, I just want to say thanks for giving me a moment of their time. I know it's always the most precious resource that we all have. So I hope I'm going to bring something that's useful to your audience, Samuel. But people might already recognize in my voice that I'm not born and bred here in the US. I'm an Aussie by background, but I'm here now in the US. And you're right, I do run HealthPoint Research, which is a market research agency for healthcare. But that by itself is not particularly interesting because there's plenty of market research companies out there in healthcare. The reason that we're a little bit different, it's kind of 2 reasons. One is the way that most salespeople in healthcare, for example, are going out giving a message or maybe showing some material or trying to convince their customers of an argument around their brands. Somewhere earlier on, that company who they work for, there's been some market research undertaken. And typically the way that works is a market research director or maybe a head of insights or something like that in a company has gone to an agency and they'd say, please go out to all of these surgeons or doctors or nurses and sometimes patients and ask a whole bunch of questions for us so that we better understand how they think about our products or their disease or whatever it might be.
Sure.
And so that's sort of this outbound market research, which is the typical way it's done. And by the way, it's a great thing that companies do that. They invest a lot of money so that when the salesperson's actually in front of their customer, they're hopefully getting best bang for their buck because we know the most as we possibly can about the condition and what's important to the doctor or whoever it might be. That's market research normally. There's a different type of market research though, which is where we specialize, and that's called syndicated market research. So this is slightly different in that instead of a company coming to us and saying, can you please go and speak to 500 doctors and ask them a series of questions? What we do instead, we like to think is a little freer from bias, because what we do is we would consider a particular facet of healthcare. So it might be a disease, let's say asthma or something like that, or it might be a surgical scenario. And what we will do is we will go and before any company has commissioned us to do work, we'll go and explore all that we can about that particular disease, for example. So if it's asthma, we'll go to respiratory physicians and maybe some nurses, maybe even parents of kids with asthma, whatever it might be. And we'll do a whole bunch of research and produce a report. And we like to do that 4 times a year. So quarterly, this report would gather a picture of the landscape of asthma, if you want to think of it that way.
Sure.
And so what we then do, we compile this really kind of nice report, and that's syndicated research in a nutshell. And then normally what would happen is those marketing research directors that I mentioned earlier, they would subscribe to something like this on a quarterly basis, and it helped paint a picture. But there's one other critical difference that really, we think we're the only people doing this specific kind of work. And that is that we don't just do kind of surveys and interviews. We then bring back this information, and this is where we're different. We apply linguistic analysis and behavioral science to the interpretation of it, first of all.
Wow,
so
that's fascinating.
It kind of adds a lot of power because, you know, as you and I both know, Samuel, human beings are wonderful, but none of us are rational, right? So when you do a survey with a doctor and they give you an answer,
sure,
they might be saying something, but what they mean is often something different. And so linguistics and behavioral science has a way of kind of getting beneath the surface and telling a much more complete and insightful story. So that's
how do you go ahead and do that part of it with the linguistics? I mean, who on the team is doing that type of work?
Well, thanks for going there, because I have to say, I am by no means an expert in linguistics, or for that matter, behavioral science. I know a little bit about that stuff, but for linguistics, what I do is I partner with some brilliant, highly qualified individuals in linguistic analysis, and they have that's a whole discipline, right? So if you speak to 5 people in a group and you say to them, how was your day yesterday? You might get 5 answers that sound roughly the same, but a linguist can look at the way you do things like choose phrasing or the intonation you use on certain words, and they do what we would refer to as sentiment analysis. So if you ask 3 of your friends, how was your weekend? And they say it was good, it was great, and I had a good weekend. Based on a handful of other factors, a linguist can say, well, actually, there's 3 distinct things that are being expressed here, even though at basic level it sounds the same.
So based on a text report, they can figure this out? I mean, are they going with you on the actual field calls to get the information?
It's all blended. So on multiple choice, a linguist can't help us at all. But when we invite someone to type out a few sentences, and they maybe do that 30 or 40 questions, so there's a handful of answers. Altogether, there's a sort of a fabric of linguistic value that every respondent would develop. And so linguistic analysis sort of tells us, we kind of group people into categories based upon the choice of phrasing, the choice of words, whether or not they say one thing on a question and then kind of modify it on a subsequent question. That can tell us how committed they are to a point of view as well. So that kind of thing. And so that's one part. The behavioral science part is something that I know a little bit more about personally, but I don't claim to be a behavioral scientist. We have a really good team of individuals doing this.
Sure.
But they particularly are focused on where the application of day-to-day bias is changing what somebody really means or acts, right? So bias, we all have bias all day long in all sorts of ways.
Yeah.
And actually, many of these biases are really useful because they just allow us to kind of get through the day without having to interpret every single piece of data around us. So for example, if you went to the pizza shop that you've never been to before, you kind of already know that you walk up to the window, you pull out $5, you pay. Even though you've never been there, you kind of know the process. And what you're sort of doing there is applying mental schemas because you kind of know what it's about. You do it on autopilot.
Right.
And so these are all sorts of different biases that get applied. So when we get survey feedback or interview feedback, the behavioral scientist can say, well, okay, this person is demonstrating a particular bias, which means they're also exposed to an adjacent idea. And so we can categorize people this way. So long story short, that really helps us get beneath the surface and say, here are what we think in healthcare are the real trends right now. Doesn't matter what someone tells us. You know, Samuel, you've got sales professional listening to this conversation right now. I can guarantee, just like I have and like you have, I'm sure, they've been in front of a doctor that says, yeah, I love your device, or yeah, I love your medicine. And yet we know that something's different by the time the action takes place, right? So we all know that. And so that's usually there's some sort of a psychological trigger that is or is not happening. So that's what we try and identify.
Fascinating. I love it. So the big question then is, how did you get into this? What's your background? Take us to where you started, and how'd you end up doing this?
Well, thank you. So, 100 years ago, I had a little bit of training back in Australia as a young guy, fresh out of school. I actually worked with young people with behavior disorders myself personally. So I'm sort of interested in the way that we all operate, but I never really had a compulsion to be, in a clinical setting or to be a therapist or anything like that. I was just sort of more interested in the way that that psychology practically comes to life. And pretty soon I got into the commercial field. I worked in Australia for a company called Optus, which is a bit like Verizon here in the US.
Okay.
This big telecommunications firm, and I was a junior marketer. And it turned out that I was, if I can say this without sounding conceited, I was reasonably good at marketing and business. And I guess that made sense because I'd had many of my own businesses. Literally, my first business I started at the age of 12, and I had employees and stuff. So kind of, I guess lots of people who are entrepreneurial by nature remember.
What kind of business was it at 12?
That first one, man, we were producing these little gifts to sell around the neighborhood. So I employed some people to help, like a handicraft kind of thing. So it was ridiculous, but believe it or not, made some money.
Very cool.
So I've had businesses this whole time. And when I got into the enterprise level organizations, I realized sometimes that entrepreneurial thing is useful. At some point, a little over 20 years ago, I transitioned to healthcare marketing. And for a while, I did direct sales myself, managed a sales team, went on to become a marketing professional in healthcare as well. And that led me to live in Europe. I spent time in the UK and in Switzerland and Australia, New Zealand, Asia, and now in North America. And I've been incredibly blessed to have had a chance to kind of do my thing in business in more than 50 markets around the world now. So it's something I love. But you're asking me, how did I get to HealthPoint Research? Why this thing? And the bottom line is that I saw a gap in the market. About 10 years ago, maybe a little more than that now, a really brilliant person, he's an American-Israeli guy called Daniel Kahneman. He was awarded a Nobel Prize in economics, but actually he's better thought of as a psychologist. And really what he told us was, we all operate in these sometimes comically irrational ways, but we as another writer, Dan O'Reilly, says, we are predictably irrational. So we all do things that are kind of irrational, but we do it in ways that you can sort of predict will happen.
Right. You kind of know we're going to do it. Right.
Right. So Kahneman won this Nobel Prize, and that happened around the time I was living in London, and I became fascinated by behavioral economics back in those days. So that's 10 years ago now. And it just struck me that while some industries started to grab onto this idea of behavioral economics, it was much slower coming to healthcare. And I have, we as your audience knows, Samuel, we operate in a deeply regulated and sometimes slow moving industry because there's so many rules, as is appropriate. There's a lot that we can't do that you can do if you were selling Coca-Cola or Toyota. But in pharmaceuticals and medical devices, we aren't always adopting the very best of current thinking. And actually, more recently, fortunately, behavioral economics has started to come into healthcare on the commercial side. But I realized that there was a lot of space in the market research, insight gathering area, particularly, that, we could provide something that is better than just, between you and I and everyone listening, I've sat in so many kind of board meetings in pharma or device company home offices when up on a screen, a really well-meaning market research firm will show us a series of charts and pie graphs and bar charts and stuff. And I remember thinking, well, that's kind of interesting, but no one's giving me the so what factor. If only I could get into the brain of the person that said yes or no to that question. And so I kind of realized that behavioral economics and linguistics would be powerful to do that. So I thought, you know what, if no one else is doing it, I'm going to go do it.
Come on. Wow. So then did you go to a team of your friends that were doing this kind of work? I mean, how did you put it all together?
Yeah. So outside of healthcare, I've been fortunate to explore my passion of entrepreneurship in sometimes little startups still, but because, being a marketing leader in these companies is often quite time consuming. The other way that I have still kind of, scratched that itch, so to speak, is I would sometimes give a talk at startup incubators or at business schools, sometimes MBA programs and things like that. I'll come in and give a talk on entrepreneurship and use of behavioral economics in that field. And so the way that I got started was because through that kind of work, I built up a really nice network of extremely skilled individuals. So in many cases, these are sort of money can't buy people. So I'll drop a name now, if you don't mind. There's a fella out in Phoenix, a brilliant man called Robert Cialdini. Many salespeople will have read a book called Influence or his other book called Persuasion. He's an absolute thought leader, right? And for for 40 years now, he's been on many people's mind as somebody who can really show us the actual mechanics of how you achieve influence.
Sure.
So through my network, I've been able to get people like Bob and some other absolute top tier individuals who very graciously have given me their time to advise on projects, and then a team of really skilled individuals like the linguistics guys and the behavioral scientists guys. They very kindly said, yeah, you know what, we'll come and help you with this. And so we're a small but very passionate team.
Okay. And so right now, how long have you been working with HealthPoint Research? How long have you guys been doing what you've been doing?
It's pretty new. So it's going to be coming up next month. It'll be 12 months. So actually it's only 11 months that we've been doing this.
Okay.
So yeah, so it's new for us. And the bulk of that time has actually been in formulating this thing we call N code. So N with a little asterisk, it's kind of a play on words of the N number that we sometimes think about in medical statistics and stuff.
Yeah,
so it's an N number, and it's N code because we use language so much with linguistics. It's the way that our answers are encoded to us. We kind of try and dig in. And so for these last 11 months, we've been really working out what N code could mean as a proprietary method for getting kind of behind the curtain in the way that healthcare professionals and patients and caregivers think.
Sure.
So, yeah.
What's the most shocking thing you've learned through this research? And I'm
wow.
not going to spoil what you're working on now, because I'm going to definitely, I want our audience is probably like, what is he working on now? Exactly. What is he working on now? But what's give us some of the shocking, or maybe not shocking is the wrong word, but just things you wouldn't expect that are actually, that are kind of surprising that is in the trends of how pharmaceutical sales representatives operate, that they're probably missing an opportunity. Like what's some data that you guys have experienced that you're like, wow, we didn't really know that?
That's a really great question, Samuel. Thanks for asking. So for me, I first came across this concept in 2010, and I've been plugging away, asking clever people like Professor Cialdini and many other people around the world. The thing that strikes me is that those biases that I referred to earlier, there are a collection of those, we might think of them as cognitive shortcuts and sometimes blind spots. There's a collection of those things that are actually much more pronounced and more rigid among expert customers than they are with, I don't consider myself an expert really compared to some of the folk in healthcare, a top surgeon, top doctor. I'm not exactly the same as them by any stretch. But what we see is that there are these little collection of psychological factors that are incredibly prevalent and very impactful in the way that these people operate. Okay. And so the most surprising thing to me is that really these folk hold on to ideas in a way that's quite different. So let me put it, maybe the best way to describe this is a little story for you.
Sure. Yeah, please.
So, if I was to tell you about something that you might not be an expert in, but maybe you're aware of it. So let's say I say to you, I grew up not far from the beach in Australia, and a lot of people in Australia surf. So let's say you don't know anything about surfing, but you've seen pictures of it, you've seen it on videos.
Yeah.
You could probably imagine what it's like to go surfing. You could, you can sort of predict you're in the water, and you might have some ideas about it. So if I asked you your opinion, you would, if I was to show a visual, you'd probably hold your collection of ideas out with an open hand, which is to say, I bet it's fun. Maybe it's hard to learn, but it's, it'd be good to do on a hot day. You'd have these little collection of ideas.
Sure.
But what an expert tends to do on a neurological level, they think very differently. So when you're holding that open hand, what you're actually doing is imagining and creating a little narrative for yourself for how you suppose that it might be.
Sure.
And so this is much more like creative thinking. So if we put you under a functional MRI while that was taking place, we would see parts of your brain that would light up that is much more like you imagining a story, right? Because maybe you've never surfed before, but you can sort of predict
I
aspects to it.
Put all my experiences that I've seen through TV and my friends and whatnot, put it together.
Exactly. And a lot of marketing is predicated on this idea. We want to give you some ideas. We want to help you flesh out a story, and then maybe you'll think more favorably about our product and maybe buy from us, right? But here's the problem. Experts think differently. So if we go to a doctor and we want them to use our medication instead of a competitor's, we say, doctor, here's some ideas for you. Think of this patient and look at this study, and you can see that we have these results. And even if the doctor's a friend of yours now after years of selling to them, and they smile nice and they say, thanks for bringing me Starbucks, and it's good to see you again, and we kind of have this chat, and maybe I'll think about your product next time I have a patient. But actually we know this happens to experts. their hand is not open like this. Their hand is actually closed. And if we put them under a functional MRI, even if they've never experienced a scenario that you're trying to describe, what happens is with people who have a lot of deep expertise in that domain, they also create a story, but it's not creative in the same way that it would be for you and I thinking about surfing as an idea. Instead, it feels, if I can use that word loosely, under functional MRI, a different part of their brain lights up, and it's much more like the recollection of a memory. And so even if it's a new idea, let's say it's a brand new molecule, and you're a salesperson in pharmaceutical, and you're out there saying, Doc, you've always used this category of medication for this disease. I want to tell you about a brand new molecule. So the doctor's never had any experience with it, right? So it's definitely hypothetical for them. And yet for them, as they're crunching the gears in their brain, it doesn't feel hypothetical for them. They actually have an experience which is much more like the recollection of a memory, which is, it feels much more dependable, is one way to put it, right? So here's what happens. You show them a clinical study, and it says that what they used to do in the past, their status quo behavior was successful 75% of the time. You show them this really nice, robust clinical trial, and actually this new molecule is effective 85% of the time. So it's better.
Right.
What that person will experience, the expert, even if they're friendly and smiling and enjoying the Starbucks, because they have in their mind what feels like a memory that's different to the paper you're putting in front of them, it's very hard for them to get over this feeling of dissonance between what you're saying to them and what they believe is actually their experience, even though we know it's not an experience. They've never been down this path.
Are you saying they're automatically rejecting it regardless of how compelling the data is? Their first inclination is to reject this information.
Pretty much. And what the social scientists will tell us is that even if they may nod and politely go, huh, interesting,
right,
what actually happens is predominantly, much more than a non-expert, these people will dismiss the concept as an outlier or an exception. That's the way they will hold together the idea of, if I put it in simple terms, the identity that person has is, the identity I should say, is that I'm an expert, and almost all the time that I'm operating in this field, people defer to me for my expertise. And so my judgment call is dependable. And so if you're showing me something that actually is in contrast to what is my current approach, it feels extremely uncomfortable at a pre-conscious level to accept this new data. So it's much more acceptable for me to nod and smile and say, thanks for showing. But at a pre-conscious level, I discard that as being an outlier or an exception, even if they won't say the words. And in fact, they're what that Nobel Prize winner I mentioned before, he talked about two ways of thinking, that autopilot system one thinking and the more deliberative system two thinking. Even if their system one is very polite and says, Samuel, thanks for letting me know, I'll give this paper a read, that looks interesting.
Right.
System two is not engaged. And the system two is that more thoughtful, deliberative, let me kind of mull over the information. It's just not engaged. And so there's the good news is, though, we're all selling to experts, and you might think, well, what do I do? Well, my clinical
how do we get to number two? Get that number two thinking going. Yeah,
exactly. So there's a handful of ways to do it, and I'm not going to give away the farm right now, but I'll give you a couple. All right.
Right.
So one really effective way, and by the way, everything that we're describing right now, Samuel, is actually going to be compiled into a book that we hope to have out this year.
Nice.
And so if your listeners want to go to your website and check it out, I'm going to make sure that we get a way to get your folks especially.
Yes.
So anyway, one way to get past this is a really tricky thing we do called, it sounds kind of spooky Halloween type of phrase, but it's called pre-mortem modeling. And what this basically means is, Samuel, if you're my expert customer, you're my, the chief doctor at a place that I need to go and kind of convince you of something important. If I know that you believe that using your current injectable medicine is the most effective way to treat a condition, and I'm saying, look, come and use this new oral medication instead, and I'm trying to convince you of something new, and you're friendly, you're polite, you say, that looks good, but I sort of sense that actually what you're doing is that system one autopilot thinking. You're polite and friendly, but I'm not getting through to that system two thinking.
Sure.
So pre-mortem modeling basically says this: I find a way just to engage you to tell me a story verbally back in which this new oral version of a treatment is going to be preferable. So what I might say to you, Samuel, is I might say, Dr. Samuel, I'm speaking to a lot of people about this stuff at the moment, but you have such a lot of experience and expertise. Explain to me why you think this might be, to many of your peers around the place, why might they like this one better, do you think? And so that they are forced at that moment, even if they're just playing a game with you, they're
Right.
forced to temporarily go to system 2.
Mhm.
They craft a little story about why this thing is great. And even if they finish the story and then go, oh, but in reality, the injectable's great still. The fact that you've taken them to system 2 thinking for a moment, they've had to form a little neural pathway around this
Yeah.
idea.
You planted the
And
seed.
so this is pre-mortem modeling. You're getting them before the event. You're getting them to actually tell the story of why your perspective is a valid one. And you might not win them on the day, but what you've done is definitely got them for a moment to give you some system 2 thinking. That's just one example, but there's a long list of ways we can get around it.
This is fascinating stuff. So does it matter the data in whatever you're showing them, for the data points in what you're showing them? For example, the size of the study, the body that conducted the study. Did this research that you guys did show that it doesn't matter? It's still going to have to go, you're still going to have to get them engaged with system 2 thinking, regardless of the data points within the trial that you're showing them?
Yeah, so there's 2 nice pieces of psychology we'd call upon for that very question, right? So what does matter? There's a few things that matter, but one thing that does matter is surprise. So surprise is effective in taking somebody from system 1 to system 2 thinking, we believe, right? So if you were to say, like you're my customer here, if I was to say to you, Dr. Samuel, how many subjects do you normally get in a trial for something like this, do you estimate? And maybe you don't know. Maybe you say, well, 500 patients or 5,000 patients. If I can surprise you somehow and say, well, you'll be amazed, this is actually 9,000 patients, or something that's somehow surprising.
Mm-hmm.
Any element of the paper that's surprising, even if it was, this nice kind of double blind crossover, whatever it might be, some way of showing that it's somehow surprising.
Yeah.
You can coax somebody into system 2. So no matter what you do, even if you have to go behind them and go boo, you want to surprise that customer a little bit.
Wow.
And so surprising is one thing.
Okay.
The other thing, now I'm a marketer. I've done more marketing than I have kind of sales and sales management. So
sure.
I'm going to speak up for my marketing friends at the moment. I know that we try and bring out marketing materials for sales professionals. And we also know that you guys think that we're a bunch of monkeys that don't really know what we're doing, right? So I kind of know that that's real. But here's the reality. If you engage multiple senses with somebody, you are also more likely to cut through to system 2 thinking, and especially with the way that you would establish something around memory. So another really brilliant woman, her name's Elizabeth Loftus. If anyone wants to look her up on Wikipedia, Loftus. Elizabeth Loftus is one of my intellectual heroes, but brilliant woman. She told us a lot about the way that we formulate memories, and she actually did a lot of, funnily enough, a lot of research in expert eyewitness testimony in a legal setting. So she knows how experts think. She also knows how memory works.
Okay.
And what we can say is that if we get you to hear my voice, look at something on a page, verbalize something back to me, if I put my hand on your shoulder, if that's appropriate in some way, if I engage multiple senses in our conversation, Samuel, you're more likely to kind of look at what I am talking about in a more deliberative sense. So you want to surprise them, and then you also want to engage multiple senses. So that marketing piece that you never want to pull out of your bag because you feel a bit ridiculous doing it, think twice about it, because sometimes it has power. Right?
So have you had the opportunity to see any of these conclusions actually play out with sales reps?
I have in a way. So there are, a handful of acknowledged pieces of evidence to show that when multiple items are presented to a customer, we kind of have a different level of traction. So that exists for sure.
Sure.
But most of what I call upon, and in the book, what we'll be talking about, is mostly drawn from other industries or other facets of life. So in government, for example, or in the military, in other industries for sure, in education. So these studies are done in all sorts of different ways. There's a handful of ways that we might engage it. And one thing that I don't want to jump the gun here with you, Samuel, but one thing that I wanted to talk to you and your audience about was a report that we're pulling together at the moment. Mm-hmm. It's called the Rep Spotlight Report. Okay. And so in terms of evidence, I already mentioned Robert Cialdini before. He's, along with Elizabeth Loftus, he's one of my heroes. But
sure,
what Professor Cialdini has offered us through him and his colleagues around the world is 7 pillars of influence. So these are empirical, right? So we know these are true. They're not in healthcare especially. They're in all sorts of ways that they're being researched. But we know that these 7 pillars of influence are factual things. So, Samuel, if I was a sales rep for a pharmaceutical company or a medical device company, I'd be speaking to my customers and I'd be saying, even if I don't say it out loud, what I'm hoping is, gee, I wish this guy would listen to the evidence base, because my product actually has a really nice evidence in support for it. So if there's one takeaway from our conversation that your audience might want to contemplate today, it's that they, as high caliber sales professionals, should also depend on an evidence base. And the good news is we do have an evidence base for what will make them a more powerful and effective salesperson. And so part of that, your question to me is, do we have evidence? Robert Cialdini et al. And the other researchers around the world, they have shown that these 7 factors of influence are very real, they're dependable, you can bank on them. And so the skill now becomes for the salesperson, how do I adopt more of that knowledge into what I do? So first protocol, get on Amazon and buy this book called Influence. You'll see it. It's Robert Cialdini's book. It's now, I think it was the mid-90s that it was released. He's since updated it a few times, but it's a timeless classic in the field.
Yep.
But more directly, what I'm so excited to have done, with Professor Cialdini's permission, we've actually taken those 7 factors and built something called the Rep Spotlight Report around those 7 factors. So we know these ideas of influence are true. There's an evidence base for them. And with this report, using that ENCODE methodology that I referred to earlier on, we've gone out to a large number of providers around the country. And we've said to them, tell us about your experience with pharmaceutical sales reps. And based on all of their feedback, we collected 10,000 data points. We're really mapping out the various companies in terms of the way that their sales reps seem to be able to capture those 7 pillars of influence amongst all of these providers around the country. And that will create for us a nice kind of leaderboard. So one of these companies is going to be sitting right out on top, and they will be accumulated over all of those 7 factors. Their sales reps on average will be getting good marks on all of those things.
Right.
But kind of more importantly and more instructionally for a sales rep who really wants to totally win this quarter, they should look at this report because it will give them some hints as to how they can step up their game for these 7 factors of influence. That's probably the most important idea. So that's the report that we're actually crunching the data for right now, and we're going to be producing that. And we're settling on the price right as we speak. But I can tell you this: we're wanting to price it so affordably that the average sales rep will be able to buy this herself or himself and put that on a credit card, and it should be the sort of thing that would cost less than a few coffees for the local office they go visit. Nice. It should be something that's really powerful and affordable for everybody. And then we might take a cut of the data to do some more elaborate work at a head office level with some of the companies that your audience work for as well.
So you heard him. So the first thing is to get the book Influence. That's number 1. And then number 2 is to get this report. And together, a pharmaceutical sales rep can have some serious insight into being much more effective and getting to that system 2 thinking to really deliver with whatever product they're representing.
That's exactly right.
Okay.
That's exactly it. And, I don't want to give it all away now, but I can tell you that in addition to those things, we're also checking out providers' opinion for a series of professional behaviors as well. So we want to know, do the companies typically have good scientific knowledge? Are they punctual and professional? Do they understand the clinical objectives of the office? All that kind of stuff. Sure. So those things we're surveying as well. We're getting a snapshot of how providers also would like their sales rep colleagues out in the field to engage with them in a COVID-19 environment. So what would you like to see from a sales rep based upon the fact that we're in this crazy world at the moment? Definitely. So this will be useful because you'll hear from the horse's mouth, so to speak. Here's what I'd really like a rep to do. I still need them to come in. I want to hear from them, and I need some samples, and I want to make sure that I'm doing things right. But I need it a bit different now. So the rep will be able to kind of get that fresh and direct from them. So.
Sure. That's excellent. So this sounds like it's pretty universal. I mean, it can work outside of a quarantine environment, and it can even work within a quarantine environment. That's a pretty universal report. Yeah,
I hope so. And the other thing we'll do is we're actually going to roll this out every 6 months. So even if somebody's listening to our conversation now, Samuel, 2 years from now,
sure.
What we'll actually have is twice a year, this report will be published, and it will show the movement of attitudes as well. Sometimes that's kind of important also. So if we find that right at the moment, a doctor, for example, is saying, because of COVID-19, I don't have enough time. So the most important thing for me is that you cut right to the chase. That might be really important right now, for example. But in 6 months or in 2 years, they might be saying, well, actually, what I need now is something somewhat different. So So the report will be always fresh and hopefully informative and help out the local sales professional.
That's excellent. So AJ, tell us the name of the report one more time.
It's called the HealthPoint Research Rep Spotlight Report.
And where can people get it?
Well, the one way would be to come to healthpointresearch.com. That's healthpointresearch.com. Right on the front page, there's a choice for the person visiting the website. They can either participate in research themselves, so that includes pharma or device reps, for example, or they can say, I want to learn about your reports. And that's the option you'd take if you want to kind of dig in and see what this current report's all about.
That's excellent. Well, thank you so much, AJ. This is something that I'm positive my audience is excited to get in front of. And I'm actually excited to get in front of it myself because I'd love to see more of these surprises that we talked about. Thank you for the time. Is there anything else you want to share with the audience today?
No, I've just loved being with you, Samuel. The final thing is I'm constantly curious. So I kind of want to know how people are operating out there. And if anyone wants to give me some direct feedback upon what HealthPoint Research is doing, I'd love to hear from them. You can hit me up on any of the social media platforms. And the other thing is that it's not just my kind of nerdy insights into things here. In the report, we also have some really esteemed sales leaders. So for example, again, I'm sort of letting the cat out of the bag here a little bit, but somebody who holds the record for having led the largest headcount of medical sales professionals in the country is providing expertise in this report. So this individual will be looking over the study and he'll basically be saying, based on what we see here, the best sales rep should be doing this, this, and this, and never doing that. So this is the sort of stuff, it's money can't buy material.
Excellent, excellent, excellent. Thank you so much, AJ. We're going to make sure people get this report. You'll be able to find the link to get access to the report in the show notes, everyone. And AJ, thank you so much for joining us.
Thank you, Samuel. Great to be with you.
Definitely. And that was AJ Rollsy. Fascinating. Didn't I tell you that was going to be fascinating stuff? To think that there's a resource out there that can allow a sales rep in pharmaceuticals or medical device sales literally be more effective by enabling them to access the system 2 thinking of a provider in a way that's more memorable than what they've been doing previously and have a bigger impact on their actual bottom line with representing the product or procedure. That's fascinating. That's very cool to know. And in addition to that, it's going to be so useful for, of course, companies that are really going to get to see what their customers think of them. Again, we can only imagine how important a report like this is. So the challenge I have for you listeners, whether you're in leadership, whether you are a sales rep, I want you to get out there and I want you to get this report. There's a link in the description of this podcast episode today that takes you directly to the report and allows you to get this report. Because you listen to this podcast, there's something special regarding the report for you. So I want you to please make sure you get this report. And I'd want to know what you guys think. I mean, this is important. When I first heard or learned of AJ's research, I was so intrigued. When he really talked about all the different things they're able to do and all the different data points that were involved, I mean, I was fascinated, and I couldn't wait to see everything that resulted in all this research. And I want to hear what you guys think as well. So get this report. Feel free to get on and leave your thoughts. You know where to go, evolveyoursuccess.com. You can go to the bottom right corner of any page on evolveyoursuccess.com, and you hit the send a message button. And let us know what you think about the report. How did it help you? How are you going to use it? What are you actually going to do with it? These are things we all want to hear. And once again, if there's something that you want addressed in any of our episodes, again, go to the website, evolveyoursuccess.com, and hit that send a message button and leave some info and leave whatever you'd like. Tell us whatever you'd like, and we'll see what we can do about getting it on a future episode. Thank you so much for listening. And if you're someone out there that's looking to get a position, you are saying, you know what? I want to be in a medical device sales position. I want to be in a pharmaceutical sales position. I want to be in a genetics sales position or a diagnostic sales position. I want to be in medical sales, then visit evolveyoursuccess.com and take the assessment. That assessment's going to give you a nice snapshot into where you are right now and what you can do moving forward. And then get in touch with me. You can find me on LinkedIn. You can send me an email at samuel@evolveyoursuccess.com. And again, thank you for listening to the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.